Yeah, now when you call 911, dispatchers here at Medic are going to ask you a lot more questions because of the coronavirus.
Any difficulty breathing? How about a persistent cough? And has she traveled or been in contact with anyone who's traveled outside the country within the last 14 days?
These are the questions Medic dispatchers are now asking on every 911 call after learning calls like traffic accidents aren't always what they seem. This change took effect this week, not only to protect their crews, but the patients. Have you transported anybody with those high-risk symptoms?
We have used our screening tool on a number of patients that we did have a suspicion of. We have transported them to the appropriate facility, and to the best of my knowledge, we have not had anyone that has shown a positive COVID test.
Just this week, we saw paramedics dressed in protective gear on a sick call at a nursing home. It turned out not to be a COVID-19 case. Still, responding paramedics followed CDC guidelines. Can you show me where the paramedics will find the masks and the gloves? So over here on the side of the truck, this is where you're now keeping all the equipment?
Yes, the protective equipment that we have for the crews so that they don't have to get into the truck in that environment and possibly contaminate it beforehand. We are keeping the equipment in this cabinet right here. So it's kept in a bin like this, and you can see we have goggles, our gowns, the gloves obviously they have in there.
On a call, paramedics wear a mask and gloves. They can put a mask on a patient if they suspect symptoms. Paramedics will then put on goggles and a gown to prevent droplets from getting on their uniform before transporting a patient. In West Charlotte, I'm Gina Esposito, Channel 9 Eyewitness News.